Hello guys! Have you ever wondered if your heart is really healthy? Today we will talk about some signs that may appear in the body and indicate heart problems. Stay with me until the end, because some of this information can really help save lives. Then leave your like so that this video reaches more people, and sign up to not miss the next content. Cardiovascular diseases are the leading cause of death in the world. Heart disease is the leading cause of death in the United States, according to the World Health Organization. Frank's sign, also called the diagonal fold of the earlobe, is a mark that has become of great interest in the medical field since Dr. Sanders T. Frank first observed it in the 70s. Apparently harmless, this diagonal line in the ear, which runs through the lobe from top to bottom, intrigued experts by being present in a significant number of patients with cardiovascular diseases, especially those with arteriosclerosis, the accumulation of fat plaques in the arteries that reduces blood flow and can result in heart attacks or strokes. This link between the Frank sign and cardiovascular health comes from a statistical observation. Several studies have pointed out that between 40% and 70% of people who have this line in the earlobe have some kind of arterial compromise, especially in the coronary arteries that supply the heart or carotids responsible for supplying blood to the brain. The sign is more common in older adults and, in many cases, becomes a possible indicator of circulation problems, causing doctors to use the presence of the fold as an alert to investigate the patient's heart health. But it is important to understand that the Frank sign is a possible risk factor, not a definitive diagnosis. Not all people who have this mark have heart disease, just as not all those who suffer from heart problems have the sign. The explanation for this connection is not completely clear, but it is believed that the hardening of the arteries, arteriosclerosis, may reflect a fragility of the arterial walls that also affects small blood vessels, such as those present in the earlobe, generating a change in the structure of the tissue that is manifested in this fold. Nowadays, the Frank sign is not used as a conclusive examination, but as part of a more comprehensive clinical analysis. For example, a cardiologist may consider the Frank sign as indicative of recommending additional tests, such as an electrocardiogram, coronary angiography, or even a cardiac stress test to accurately assess the presence of arterial clots. Studies suggest that the sign may be more frequent in certain groups, such as people with a family history of heart disease, hypertension, diabetes, smoking, and obesity. These factors contribute to the cardiovascular risk itself, which makes the Frank sign a possible physical manifestation of underlying health problems. In summary, the Frank sign is a physical feature that generates a lot of curiosity and a certain clinical value as a point of attention. However, its isolated presence is not sufficient to diagnose heart problems. The alert therefore serves as an opportunity for prevention and screening, especially for those who already have other risk factors for cardiovascular diseases. The loss of hair on the legs, especially in the shins and rising towards the thighs, can be an important sign of a condition known as peripheral arterial disease (PAD). PAD is a form of atherosclerosis that affects the peripheral arteries, those outside the heart, such as the arteries in the legs and arms. This problem occurs when the accumulation of fat plates in the arterial walls reduces blood flow, and, with it, limits the amount of oxygen and nutrients that reach the tissues. This circulatory impairment can directly affect the hair follicles, causing a decrease or interruption in the growth of hairs in the affected areas. Hair follicles, which are small organs of the skin responsible for producing hair, depend on a continuous flow of blood to stay healthy. When blood flow is reduced by atherosclerosis, the follicles cease to receive essential nutrients and oxygen, causing hair loss. This may occur gradually, usually starting in the most distant areas of the body, such as the shins and feet, and may extend to the thighs, depending on the degree of arterial obstruction. The loss of hair is therefore a sign that something more serious is happening in the blood vessels, indicating a possible limitation in the circulatory system's ability to supply the body's needs. In addition to hair loss, PAD can cause a number of changes in the skin and tissues of the legs. The skin tends to become smoother and thinner due to decreased nutrients, and many patients report that the affected area becomes cold to the touch, a result of low blood flow. Another common symptom is the impact on nail growth, which can become brittle and grow slower, another direct consequence of decreased nutrient supply. Leg hair loss and other skin changes are not just an aesthetic problem. They are a warning sign for vascular health. People with PAD often have other associated symptoms, such as pain in the legs when walking, called intermittent claudication, muscle cramps, tingling, feeling of heaviness in the legs, and in advanced cases, wounds that take a long time to heal, or even gangrene. Peripheral arterial disease is a risk factor not only for leg problems, but also for the overall health of the cardiovascular system. Studies show that people with PAD have a higher risk of developing other cardiovascular diseases, such as heart attack and stroke, since atherosclerosis is not restricted to one area of the body, but can affect several arteries throughout the system. To diagnose PAD, doctors use a series of tests such as the Arm-Ankle Index, ITB, which measures blood pressure in the ankles relative to the arms, and vascular ultrasonicators, which help visualize blood flow in the arteries of the legs. Once the condition is confirmed, treatment may include lifestyle changes such as quitting smoking, eating healthy, and practicing physical activities to improve circulation. In some cases, medications are prescribed to reduce cholesterol and blood pressure, and in more severe situations, interventions such as angioplasty or vascularization surgery may be necessary. The observation of hair loss on the legs, especially when accompanied by other signs such as cold and smooth skin, is an opportunity to act preventively against a condition that may have serious consequences. Xanthelasma is characterized by yellowish plaques that appear on the eyelids, usually around the inner corner of the eyes. These lesions are cholesterol deposits that accumulate in the upper layer of the skin and, although they are not painful or malignant, are a visible manifestation of an internal problem: high levels of cholesterol and triglycerides in the blood. The presence of xanthelasma is an important sign, as it indicates a possible lipid imbalance, a risk factor for cardiovascular diseases. The cholesterol that accumulates in the eyelid region to form xanthelasma is usually LDL cholesterol, known as bad cholesterol, which at high levels tends to adhere to the walls of the arteries and form plaques that obstruct blood flow. This process, called atherosclerosis, increases the risk of serious problems such as heart attacks and strokes, CVAs. People with xanthelasma have a significantly higher chance of having high cholesterol or another lipid disorder, and studies suggest that between 50% and 75% of xanthelasma cases are associated with elevated cholesterol or triglycerides. This manifestation may appear at any age, but is most common after 40 years and tends to be recurrent in individuals with a family history of high cholesterol or heart disease. Although xanthelasma is harmless and generally asymptomatic, its presence should be seen as a warning sign. When observing these spots, the recommendation is to seek a medical evaluation to investigate blood cholesterol and triglyceride levels. For an accurate diagnosis, the doctor can request a complete lipid profile, which measures total cholesterol, LDL, HDL good cholesterol, and triglycerides. If the results indicate elevated levels, measures should be taken to control these lipids and thus reduce cardiovascular risk. Treatment for xanthelasma involves both control of cholesterol levels and removal of plaques, if the patient wishes. In the case of removal, methods include procedures such as surgical excision, laser, electrocautery, and even chemical peeling. But even after removal, xanthelasma can return if cholesterol levels remain high. Thus, cholesterol control is essential to prevent the plaques from returning and to prevent the risk of atherosclerosis. The approach to controlling cholesterol levels often involves lifestyle changes, such as a balanced diet rich in fiber and low in saturated and trans fats, regular physical activity, reduced alcohol consumption, and smoking cessation. In many cases, the doctor may also prescribe cholesterol control drugs, such as statins or fibrates that work by reducing LDL and triglycerides in the blood. Xanthelasma, therefore, goes beyond an aesthetic problem. It is an external sign that may indicate an internal risk to cardiovascular health. Ignoring these yellowish plates can be a valuable missed chance to take preventive action against potentially fatal conditions. Therefore, when you notice the presence of these plaques on your eyelids, it is essential to investigate cardiovascular health, since treatment and prevention can help control the problem and protect the heart. The senile arch, also known as gerontoxin, is a whitish or grayish ring or arc that forms around the rim of the cornea, the light and rounded part of the eyes. Although it is more common in older people, where the name senile comes from, it can appear in young adults, and even in people under 45 years. In younger people, this arc can be an important sign, as it suggests elevated levels of cholesterol and triglycerides in the blood, which is associated with a higher risk of cardiovascular diseases, such as heart attack and stroke. The senile arc is composed of fat deposits, mainly cholesterol and phospholipids, which accumulate in the outer layer of the cornea. As these substances are deposited, they form a ring that can vary in intensity, going from a lighter, whitish color to a grayish tone, depending on the amount of lipids and transparency of each individual's cornea. In the elderly, the senile arc is generally considered a natural part of the aging process, and in many cases, it is not associated with specific health problems. However, when the arc arises in young people, it is an indication that something is not right with lipid metabolism. In people under 45 years old, the onset of the senile arc may be a sign of dyslipidemia, a condition characterized by high levels of LDL cholesterol, bad cholesterol, and/or triglycerides in the blood. This accumulation of fat in the cornea is similar to that which occurs in the arteries, where atherosclerosis plaques narrow the space for blood flow and can lead to serious complications. In cases of early senile arthrosis, the doctor recommends blood tests to measure the complete lipid profile and assess cardiovascular risk. Once abnormal levels of cholesterol or other lipids are detected, it is crucial to act to reduce these levels, thus preventing heart problems in the future. Although the senile arch itself does not interfere with vision or cause painful symptoms, its presence can be seen as a marker for what is occurring inside the body. The similarity between the process of lipid deposition in the cornea and arteries suggests that the senile arch may be an external representation of the atherosclerosis process. In addition, when present in younger individuals, it has been associated with an increased risk of heart disease, which makes it essential to treat the underlying condition. Controlling cholesterol and triglyceride levels may involve lifestyle changes, such as adopting a balanced diet, with an emphasis on foods rich in fiber and omega-3, which help reduce bad cholesterol. Regular exercise is also recommended, as exercise helps increase levels of HDL cholesterol and improve circulation. In some cases, the doctor may prescribe medications, such as statins, that reduce cholesterol production in the liver and consequently LDL levels in the blood. In summary, the senile arch is a ring that may be only a feature of age in older individuals, but in young and adults under 45 years old, it should be seen as an important warning sign. Ignoring the senile arc in younger people may be missing an opportunity to take preventive action against heart disease and other complications related to atherosclerosis. When you notice this ring, it is essential to seek a medical evaluation to check the lipid profile, and if necessary, start treatment to reduce cardiovascular risk and keep the circulatory system healthy. Cyanosis is characterized by a bluish or purplish color that appears on the skin and mucous membranes, such as lips, nails, and body extremities, due to a low concentration of oxygen in the blood. This coloration is the result of a physiological process in which the body tissues, when receiving less oxygen than necessary, become hypoxemic, leading to insufficient saturation of hemoglobin, the protein responsible for transporting oxygen. Cyanosis is an important warning sign because it indicates that something is preventing the blood from carrying or distributing oxygen effectively, which may be related to severe heart, lung, or circulatory problems. There are two main types of cyanosis: central and peripheral. Central cyanosis occurs when there is a significant decrease in the oxygenation of blood that leaves the heart, being perceived mainly on the lips, tongue, and oral mucosa. It is often associated with lung problems such as chronic respiratory diseases, COPD, severe asthma, among others in severe heart failure, where the heart is unable to properly pump oxygen-rich blood to the body. Peripheral cyanosis is more common in the extremities of the body, such as fingers and toes, and occurs when blood circulation is impaired, often due to narrowing of the arteries, as in cases of DAP, peripheral arterial disease, and vascular insufficiency. In this condition, blood flow is insufficient to carry oxygen to the extremities, which can be aggravated by cold, stress, or wearing tight clothes that restrict circulation. An important factor in the occurrence of cyanosis is oxygen saturation, measured by oximetry. When the oxygen saturation in the blood falls below 85%, the skin begins to exhibit this characteristic bluish color. This low level of oxygenation can be caused by a variety of conditions, such as lung disease, pulmonary embolism, congestive heart failure, and high-altitude conditions where the air is thin and the body cannot properly capture oxygen. In newborns, for example, cyanosis can indicate congenital heart or respiratory problems and requires immediate medical attention. Cyanosis is a sign that requires detailed medical evaluation, especially if it occurs suddenly or persistently. By observing this purplish color, the doctor can perform physical examinations and diagnoses such as arterial blood gas, which measures the levels of oxygen and carbon dioxide in the blood, electrocardiogram (ECG) to check the heart function, and imaging tests such as echocardiography or tomography, depending on the diagnosis. Identifying the underlying cause is essential to targeting treatment, as cyanosis is a symptom and not a disease itself. Treatment of cyanosis varies according to the condition that causes it. In cases of lung disease, the use of oxygen therapy may be indicated to improve blood oxygenation and relieve symptoms. For heart problems, medications that strengthen cardiac function, or in severe cases, surgery to correct heart defects may be necessary. In people with peripheral cyanosis caused by circulatory problems, treatment may include medications to improve circulation, such as vasodilators, and preventive care to keep the body warm and avoid wearing restrictive clothing. Lifestyle changes, such as quitting smoking, doing physical activity, and adopting a balanced diet, are also essential to improving cardiovascular health and preventing problems that lead to cyanosis. Cyanosis is therefore more than a simple change in skin color. It is a sign that the body is having difficulty transporting or distributing oxygen properly. Ignoring this symptom can lead to serious complications, such as tissue damage due to lack of oxygen, and in extreme cases, organ failure. When you notice this bluish color, it is essential to seek medical advice to assess your heart, lung, and vascular health, and thus ensure that the body receives the oxygen needed to function well. Ulcers that do not heal, especially in areas such as legs and feet, are an important warning sign for blood circulation problems, often related to arterial obstructions, a condition known as peripheral arterial disease (DAP). These wounds, known as ischemic or arterial ulcers, develop when blood flow to the tissues is insufficient to provide oxygen and nutrients necessary for skin regeneration. Over time, the lack of proper circulation prevents the natural healing process, making these ulcers become persistent, painful, and prone to complications. These ulcers have particular characteristics. They usually have well-defined edges, are shallow, and exhibit a pale or dark color around. The skin around it is usually cold to the touch and may have a shiny, dry appearance. Pain is another common symptom and tends to worsen when the affected leg or foot is elevated, as elevation further reduces blood flow to the region. When the person puts the limb down, pain may be slightly relieved due to temporary increased circulation. This constant discomfort is a clear sign that the tissues are suffering from oxygen starvation, making the area extremely vulnerable to infections. The main cause of these ulcers is atherosclerosis, a process in which the arteries become narrowed due to the accumulation of fat plaques, cholesterol, and other substances. As the arteries become narrower, blood flow is reduced, making it difficult for oxygen and nutrients to reach tissues further away from the heart, such as feet and legs. When skin damage occurs in these regions, the body cannot start the healing process properly because blood supply is severely compromised. This process can be aggravated by factors such as diabetes, hypertension, smoking, high cholesterol, and sedentary lifestyle, which are known to increase the risk of atherosclerosis and, consequently, poor circulation. Patients with diabetes, in particular, are more vulnerable to developing non-healing ulcers. Diabetes damages blood vessels and nerves, leading to loss of sensation in the feet and legs, a condition known as diabetic neuropathy. This causes small bruises, calluses, or cuts to go unnoticed, evolving into ulcers without the patient noticing. As a result, many of these wounds are only detected at an advanced stage when the infection is already present, and healing becomes even more difficult. Treatment of non-healing ulcers should focus on both improving blood circulation and wound care. First, the doctor may recommend tests such as ITB ankle brachial index and Doppler ultrasound to assess the extent of artery blockages and determine the level of blood flow in affected limbs. Depending on the severity of the condition, treatments that include anticoagulant drugs, antihypertensive drugs, and cholesterol-lowering agents may be indicated to improve circulation. In more severe cases, procedures such as angioplasty or revascularization surgery may be necessary to restore blood flow in the blocked arteries, facilitating the healing process. Local care of ulcers is also essential to prevent infections and promote healing. The wound should be kept clean and protected with appropriate dressings, which help to keep the environment moist, promoting tissue regeneration. Changing habits is also critical to treatment success. Quitting smoking, adopting a balanced diet, controlling diabetes and blood pressure, and practicing regular physical activity can improve vascular health and reduce the risk of new ulcers. Ignoring unhealed ulcers can lead to serious complications, such as infections, gangrene, and even amputation in more advanced cases. When blood does not reach the tissues properly for a prolonged period, they begin to die, increasing the risk of gangrene and requiring surgical interventions to prevent the infection from spreading. In addition to the physical impact, these complications also significantly affect the patient's quality of life, which includes dealing with chronic pain, mobility limitations, and emotional stress. Therefore, when you notice wounds that do not heal, especially on the legs and feet, it is essential to seek a medical evaluation to investigate the presence of vascular diseases and start treatment as soon as possible. With proper attention and medical care, it is possible to avoid complications and ensure that blood circulation is restored, promoting healing and health of the affected tissues. Swelling in the legs, especially around the ankles, is a common symptom that indicates fluid accumulation in the body, a condition called edema. This buildup can occur for a variety of reasons, but when it is persistent and tends to get worse throughout the day, especially in people who are standing for long periods, it may be a sign of heart failure. This type of edema is closely linked to the heart's inability to pump blood effectively, which leads to fluid accumulation in the lower extremities of the body. Heart failure occurs when the heart cannot adequately meet the body's needs. With the weakening of the heart muscle, circulation is impaired, and consequently blood begins to accumulate in the veins. This increased pressure in the veins pushes fluid from the blood vessels into surrounding tissues, causing edema in the legs and ankles. This phenomenon is even more evident at the end of the day, because the effect of gravity causes fluid to accumulate in the lower regions of the body when a person remains standing or sitting for long periods. In addition to visible swelling, edema in the legs can bring other uncomfortable symptoms such as feeling heavy, tired legs, and, in more severe cases, pain and discomfort. The skin may also look stretched and shiny, and when you press on the swollen spot, a small mark is left that takes a few seconds to return to normal. Over time, the skin in these areas may become more vulnerable, dry, and even develop sores or ulcers, especially if the problem persists without treatment. Edema due to heart failure may be aggravated by other factors. Conditions such as hypertension, diabetes, kidney disease, liver problems, and obesity increase the risk of developing heart failure and consequently edema in the legs. In addition, the use of some drugs such as antihypertensives, anti-inflammatory and corticosteroids can contribute to fluid retention in the body. To identify the exact cause of edema and to assess whether it is related to heart failure, doctors usually perform tests that evaluate cardiac function, such as echocardiography and electrocardiogram, in addition to blood tests that check the level of proteins and other markers that indicate the performance of the heart. In more severe cases, imaging tests such as chest X-rays are done to see if there is fluid accumulation in the lungs, which is an indication of advanced heart failure. Treating leg edema caused by heart failure involves controlling the underlying heart disease and reducing fluid accumulation in the body. Diuretic drugs are widely used to help eliminate excess fluid, relieve swelling, and reduce pressure on the heart. In addition to diuretics, drugs that help the heart pump blood more effectively, such as angiotensin-converting enzyme ECA inhibitors and beta blockers, may be prescribed to improve cardiac performance. Lifestyle changes also play an important role in controlling edema. Reducing salt intake, which contributes to fluid retention, is an essential measure. Staying active with regular, light physical activities like walking helps improve blood circulation and prevents fluid accumulation in the legs. Lifting your legs during rest, lying with your legs higher than your heart, is a practice that helps relieve swelling by allowing the blood and fluid accumulated to return more easily to the circulatory system. Ignoring the edema in the legs can lead to serious complications. In addition to the increasing discomfort, chronic fluid accumulation can overload the heart and kidneys, aggravating heart failure. The skin in areas affected by edema can become fragile and prone to infections, which in people with poor circulation take longer to heal and may even become chronic, resulting in hard-to-treat ulcers. Therefore, edema in the legs should be treated as an important sign and never ignored, especially if there is a history of cardiovascular diseases. Seeking medical advice early on allows for early diagnosis and treatment, which can improve quality of life and prevent the progression of heart failure and other associated diseases. Now let's look at the tips to keep your heart healthy and prevent problems in the future. Healthy eating. Maintain a diet rich in vegetables, fruits, whole grains, and lean proteins. Exercise regularly. Even a 30-minute walk can help a lot. Stress management. Relaxation techniques, such as meditation and deep breathing, can make a difference. Regular checkups. Visit your doctor periodically, especially if you have a history of heart disease in the family. If you have come so far, congratulations for informing yourself on this important topic. Don't forget to like, subscribe to the channel, and share with friends and family. The more people know of these signs, the more lives can be saved. Leave in the comments if you or someone you know has had any of these signs. And tell me, where are you watching? Until the next video.